Circumcision is a procedure which is done to remove excessive foreskin from the penis, or it is sometimes done to remove unhealthy foreskin from the penis. Where is circumcision actually required? Who are the people who need it? Is it beneficial on a person even if he doesn't need it? Let us just go through a few things to understand these topics. By and large, in societies like USA and Australia, circumcision is done for all male born children. This is on the premise that a healthy penis is developed when the foreskin is taken away, and they get immunity to some extent against diseases like cancer of the penis at a later stage, or the urinary passage infections become less. When it comes to society like India, do we advocate circumcision for everybody? May not be possible. But there are some medical conditions which demand circumcision. These conditions are when the prepuce or the foreskin of the penis is very tight and it cannot be retracted back on the penis to expose the glans or the tip or the head of the penis, what is called in local language. Circumcision is indicated. Why is this required? So what happens if it doesn't get exposed or if it cannot be seen outside? The tip of the penis, also called as the head of the penis or the glans, needs to be cleaned. This is the point where the secretions from the prepuce or the foreskin get collected, and once that gets collected, they can get encrusted or infected and start causing trouble to the penis directly or indirectly. There are certain other conditions wherein circumcision is indicated, especially among the diabetic people. The foreskin of the penis, which once upon a time was normal, starts getting infected and fissured. Suddenly, at one point in time of their life, they start realizing that they are now unable to retract the foreskin backward. This is a condition called as balanitis, that is infection of the foreskin. This also warrants both medical management of the infection and circumcision to prevent further progress of this disease called balanitis. In India and many parts of the world, there are certain religious people who undergo circumcision for religious beliefs. That is a different topic by itself. So, if you think your child has a problem or you have a problem with respect to foreskin of the penis, please go and meet your urologist or andrologist and take medical advice whether you need circumcision or not.